The Alps Proximal Tibia Plating System from DePuy Orthopedics represents the next generation in anatomic locked plating of tibial plateau fractures. It features Timax, low-profile, anatomically contoured implants designed to provide optimum plate conformity and subchondral support while minimizing soft tissue irritation. The Alps Proximal Tibia plates achieve optimal plate-to-bone conformity by way of two unique lateral proximal tibia plate shapes. These two plates are categorized as the standard curve and large curve and are available in multiple lengths. The dual slope shapes allow the plate's contour to more closely conform to the patient's metaphyseal flare. The Alps Proximal Tibia plates incorporate a unique double raft row of proximal screws designed to achieve optimal subchondral support within the tibial plateau. The plate's two kickstand screws are positioned to thread between the screws of the proximal two rows, maximizing the plate's ability to secure a large range of metaphyseal area from the lateral side. The two most proximal K-wire holes have been designed to accommodate the passing of sutures through the plate after permanent fixation has been achieved. These K-wire suture holes provide temporary fixation when K-wires are used. They also facilitate suture placement if re-securing the meniscus is needed. The Alps Proximal Tibia Plating System allows the use of locking, variable angle, and non-locking screws. This hybrid fixation concept allows the surgeon to stabilize the fracture either by use of lag screw techniques through the plate or by compression plating techniques. Locking screws serve to provide stability to comminuted unstable fractures or an osteopenic bone. Position the patient supine on a fluoroscopic table. A standard lateral S-shaped incision is made, centered on Gerdy's tubercle. Select the plate that best conforms to the patient's anatomy with a length that allows a minimum of 3 screw holes to be placed in the tibial shaft, distal to the fracture. The plate is guided down the shaft of the bone by the attached plate handle. Position the proximal end of the plate as close to the articular surface while allowing the plate's contour to most closely conform to the patient's anatomic metaphyseal flare. To ensure optimal fit, insert a 1.6 mm fast guide adapter into a fast guide in the proximal row and insert a K-wire through the fast guide adapter. The plate is in its optimal position when the K-wire runs parallel to the joint line. Insertion of a 3.5 mm low-profile non-locking cortical screw can be used in any screw hole on the plate to achieve adequate reduction. When inserting a locking screw in the head of the plate, slide the drill measuring sleeve onto the 2.7 mm drill bit. Drill through the fast guide. Read the measurement of the locking screw length from the proximal end of the drill measuring sleeve. Next, remove the fast guide and insert the predetermined locking screw. Repeat this process for the remaining raft rows and kickstand screw holes. To achieve a variable angle screw trajectory, insert the 2.7 mm end of the 2.7 mm drill guide into the plate hole and angle the drill as needed within an arc of 25 degrees. Drill accordingly and then measure the drilled hole with the bone depth gauge by taking a direct reading from the lock line. Insert the appropriate length 3.5 mm multi-directional screw. When inserting a locking screw in the shaft of the plate, screw the 2.7 mm locking drill guide into the threaded plate hole until fully seated. Drill both cortices with the 2.7 mm drill bit to the desired depth and read the depth measurement from the drill bit at the top of the drill guide. Remove the locking drill guide and insert the selected locking screw. Remove any non-locking screws and replace with the adequate 4.0 mm or 3.5 mm locking screws if needed.